certified plastic surgeon specializing in body recontouring surgery. And today I wanted to touch again on body recontouring following significant weight loss. This is a fairly common problem, and we see it both in men and women. It can be for folks who have had some type of surgical procedure that affords them a significant amount of weight loss, or it can be they can have done their weight loss on their own through diet and exercise. What is significant weight loss? Usually that's about anything over 50 pounds, but I see folks who have lost 50, 70, 100, 130 pounds, and that takes a toll on the body. These folks have been overweight for quite some time, and when they lose that amount of weight, they're left with a significant amount of hanging skin. The four areas that they come to see me about are fairly typical. It's skin that hangs from the arms, for women, or I suppose men could have the same problem, breasts that are now deflated and sagging, abdomens, sagging skin around the abdomen, and the inner thighs. Those are the four areas that typically people consult me about. Now, when someone comes to me with the complaint of sagging skin following this type of surgery or dieting, it's important that they have completed their weight loss and have a stable weight at that point. Otherwise, I'm trying to hit a moving target. Second, of course, they need to be healthy. Normal body mass index, no significant medical problems, heart, kidneys, lungs, that kind of thing. Stable for a cosmetic procedure. And the third thing I ask them is, what bothers you the most? Because I'm not doing all of that stuff at the same time. Could it be done at the same time? You know, the extreme makeover type of situation? Sure. People do that from time to time, but it cannot be done, it should not be done as an outpatient. That's just not safe. Any amount of surgery can be done in a hospital, but then the patient gets transferred to the observation unit, gets admitted to the floor, and is in the hospital for a few days. But as an outpatient, no, that's just not safe. So I do one thing at a time. So I ask them to prioritize. What bothers you the most? Sometimes patients will say it's their arms. They don't want to, have to wear long sleeve shirts all the time. Now, that operation is called a brachioplasty or arm lift, and basically it takes care of that hanging skin, that wing that hangs underneath the back side of the arm, which is what we call the tricep area. And that's a fairly straightforward operation. The way I approach it is I first do some liposuctioning in the area to try to give a nicer tapered look, and then a elliptical strip of skin and subcutaneous fat is taken off the backside of the arm in such a way that the resulting scar, is well hidden. Obviously, you can't cut the skin without leaving a scar, but I like to put the scar in a place that is only visible if the patient wants to show the scar. They move their arms that way or this way and so forth. The recovery for that operation is fairly minimal. I don't use drains. I just wrap up arms, and most folks are back to work desk jobs in 5 or 6 days. The second area is the breasts. After weight loss, breasts are deflated. It's like hanging skin, so breasts need to be lifted back to where they were before. Often patients want to add volume in addition to that, and I'm open to that, adding an implant underneath a breast lift. It's called an augmentation mastopexy. I can't make the breast terribly much larger, but adding some more volume is certainly a possibility. That does leave scars, of course, around the breast itself, but the scars are well hidden, obviously, in a bra. And again, that operation is done under general anesthesia, and the recovery for that is not terribly protracted. If implants are used, I treat them just like an augmentation. Got to keep your arms down for a couple weeks. So that's an issue for women who, hairdressers, bartenders, waitresses, that thing. You got to be able to keep your arms down for a couple weeks. The third area is the abdomen. A lot of hanging skin on the abdomen. If the patient has had a pregnancy, that can exacerbate the problem because the foundation's been stretched out. But either way, the excess skin has to be removed, and I do that through a standard abdominoplasty, and I think I've discussed that on one or two occasions on this broadcast. It's simply a matter of cutting out the extra skin, tightening up the foundation, pulling things down, relocating the belly button, but that is an operation that does have some post-op recovery issues. No heavy lifting for 3 weeks. 10-pound lifting limit, 3 weeks. So folks who are at more active jobs, they have to take that into account. The fourth area is the thigh lift, and this is something that I do not do, but other doctors may. It's simply the hanging tissue, the hanging skin in between your thighs. That is very typical with following weight loss. I don't do that operation because even in the best of hands, that has a fairly high complication rate. The scars can be problematic, so I just decided a long time ago I'm not going to do that operation. But as I say, there are other people who may be able to help you there. So that's kind of how it works with post weight loss body recontouring options. Now, I wanted to let you know of next week. I'm going to be on Krista's radio show, Jams 93.1. Krista has a segment called Fit and Fabulous, and I'm going to be talking with my friend Jessica, who works with me with Ideal Implants around 7:40 in the morning. So please make sure you join me for that. Other than that, I have only one thing to say. Go Brewers! And I'm making a big prediction, Brewers in 6. See you next week.